Yeah, guys, this is a long video. It's about lateral chop in different cases. First case, we're gonna start with small pupil was pupillary membrane that I excised, and I'm placing this B-hex ring. This is a good device to have a 6 millimeter hexagonal pupil to work on during cataract surgery. In these cases, with where the pupil is not a good size. This is a closed angle glaucoma, also in very shallow anterior chamber. You see the fact that I'm able to reach the flange where the notches are just by slowly going on top of the B-hex ring and achieving the middle of that flange to be able to place it in the pupillar margin. This horizontal chop, first one, and this second one is a lateral chop. Basically, it's the same principle that we use in a horizontal chop, but instead of going in front of the phaco needle, we go across. So basically, we go 90 degrees away from the phaco probe. It's like perpendicular to the phaco probe. First chop is horizontal chop, when the chopper is placed right in front of the phaco needle, and then inside that trench we stay with the phaco needle and without engaging the foot pedal, just mechanically we hold the nucleus steady, half of the nucleus, and with the chopper reaching across, mechanically dividing the half of the nucleus into two smaller sections. Again, in this case, first one is a horizontal chop, and then going across perpendicular to the phaco probe, we go with the chopper and come towards the phaco needle, and in this way the chopper is able to crack the nucleus, half of the nucleus, and we have two quattros. It's a nice versatile chop, and it's very useful to know and practice, especially in the cases where we cannot rotate the nucleus inside the bag. See in this case that again the last half of the nucleus is divided into two quadrants by just holding the half steady inside the bag with the phaco needle without engaging any ultrasound. Again, the last quarter of the nucleus can be divided the same way, holding it in place with the phaco needle, just mechanically, not with phaco power, pressing the foot pedal just on irrigation first level, without any vacuum, without any ultrasound, and keeping the piece of the nucleus in one place and reaching across with a chopper, and that's a very easy way to divide the nucleus into smaller and smaller pieces that are very easy to aspirate, chop further, and aspirate and take it out of the eye. In this part of the video, I'm aspirating the last remnants of cortex using the phaco probe. It's a nice and useful technique to master it. In the beginning will feel a little bit scary, but when you get used to it, you're gonna see that it's very easy to do. And again, continuing with the horizontal and lateral chop, it's keeping the nucleus steady in one place, giving the phaco needle in the middle of that nucleus and holding it steady with that needle, and then going across 90 degrees away from the phaco needle with the chopper, and we can split in smaller and smaller sections. This horizontal chop, it's nice versatile way of doing horizontal chop basically, because it's a different angle in which you place the chopper, but the principle of chopping is the same. Going across the equator of the nucleus with the chopper and coming towards the phaco needle. It's very important to reach underneath the capsular axis in order to not have any zonular disturbance. Once you have a crack down finished, you can go in that trench and all the way to the equator, and then move it across, move it anywhere you like the phaco needle, and further divide the nucleus. You see how easy to engage the nucleus, holding it in place with the phaco needle and then chopping it with the chopper. You can use longer choppers like 0.5 millimeters, or these short ones that I show you here, which is around 0.35 millimeters in length. The very last part of the chopper tip. Once you get used to that horizontal chop, just going across the equator of the nucleus, and it's very easy then to get versatile and try this lateral chop, which is coming perpendicular to the phaco needle. Basically, we have to keep in mind the capsular axis edge and go underneath that capsular axis. To be able to easily do that, you go on top of the nucleus, disturb the cortex, and by disturbing the cortex you make sure that that's the plane under the capsular axis, and this way you don't go across over the capsular axis and you are in a safe area. You're not gonna accidentally engage the bag and make zonular dialysis. It's very easy in grade 3 plus nuclear sclerosis. In the softer nucleus, it's a little bit more tricky, but it's not impossible to achieve this horizontal chop, and the lateral chop the same way. And starting with the case in which I have to use the B-hex ring, finishing the same way. Again, closed angle glaucoma in which the anterior chamber is very shallow. In this case, the pupil is a little bit more dilated, but not very big pupil, so I prefer to use this B-hex ring. Again, in this case, again I'm trying to place the 3 flanges which are with notches underneath the margin of the iris, and then the straight flanges will be left on top. Some surgeons prefer the other way around. Is not really making a lot of difference. As long as 3 flanges are underneath and 3 on top, you are good to go and have nice 6mm opening from which you have to perform the phacoemulsification, and it's very easy to do that. Incising the capsule with the knife and using the 25 gauge forceps, I'm able to fashion a round capsulorhexis. Usually it's not a big deal to achieve good round capsulorhexis using a forceps. It's very easy to control the margin of the rhexis with the forceps, especially if you go through the small incision. You're not going to lose anterior chamber depth, so it's very easy to perform capsulorhexis. Again, engaging the nucleus, and this is a case of 3+ nuclear sclerosis. Did first the horizontal chop, and then placing the phaco needle in the middle of that range and doing the horizontal chop. I hope you like this method and find it useful in your career. Thank you for your attention. Hope this will help you in your practice also.